Do you think, though, it's worth distinguishing between something like the Piezo cut, the way Dr. Lipkin does it, versus like a dome? Because if you look at the dome procedure, it's uh, it's completely in a category of its own as compared to Dr. Lipkin's Piezo cut, which you don't even see blood. When I went to his course last weekend, he demonstrated it live on a patient while we were all there. There, you don't even see bleeding. It's a like a 8-minute procedure where he just goes in and basically this is the model that he had us practice on. All the attendants, I was the only non-doctor, obviously, but he guided my hand as I did this with the piezo knife. um, you go in here above the two front teeth, carefully avoiding the roots of the teeth so as to minimize the issue you spoke of earlier, which is possibly compromising the ligaments or the roots of the teeth. um, and then you come through here as well. The thing takes like 5 minutes to do, and there's not a drop of blood, and apparently the patients react pretty positively to it. He does it right in his office under local anesthesia. That's nothing like the dome surgical assist, right? Can we
Yeah,
can
of
we say
course.
that?
It's nothing like a dome, but in the same time, it's still a surgical procedure. And there are complications from piezo. We have
Hmm.
been doing piezo for a lot of periodontal indications, and piezo is not without complications. So, what I'm saying is, my point here is it really necessary? If you can achieve, if I get a result without piezo, why would I want to do piezo? To
True.
do piezo between the front teeth that are very crowded, there could be a complication
Hmm.
to the periodontal support of these teeth, and it could be a complication that is going to be more significant than doing it the way the surgeons break the bone with the chisel. So I think I am very cautious. As a periodontist, I'm very cautious to introduce any type of surgical intervention to be used in the traditional orthodontic practice by a provider that is not doing surgery.
Hmm.
So I think Piezo is a great tool when it's necessary, but when it's not necessary, don't use the Piezo. And it's also a tool that is designed to be used by a surgeon. So I think that the orthodontists, although it looks like it's very easy to use, need to be properly trained to make sure that they don't face the complications that you can get with piezo. That's what I'm trying to say here.
Sure, sure. Like necrosis, for example.
Like a non-union of the bone, you can overheat the bone. There are different phenotypes of the bone. In some patients, you have a very soft bone and the piezo goes through very easily. But in some patients, you can really get overheating of the bone and achieve non-union.
Hmm.
And I think if you can split the bone without piezo successfully and predictably, and that's what I'm trying to do. I'm trying to split it without piezo, and it splits. So why would I want to open any type of wound and do any type of surgical cut when I can achieve it without surgery? So I think in the end, probably there will be limited number of patients that will benefit from the piezo facilitation, any type of other surgical facilitation uh, based on the patient's anatomy. But I think based on the tools that we have with the implants and the customized the 3D planning, you can avoid piezo in the majority of the cases.
Hmm. Hmm. Again, I agree with you.
That's
Surgery should only be
my
done if
conclusion based on my experience.
I, look. I think surgery, if unnecessary, obviously should be avoided, right? Um, just a last word in defense of at least Dr. Lipkin's use of the piezo. He in his course where he teaches people how to do it, he goes through a whole series of complications that can arise from piezo, such as overheating, and then instructs how to avoid it, such as by making sure you don't hold the piezo too long in one place, causing overheating, sort of dipping it in and out to allow fluids to enter and cool the site, again, to prevent overheating. And of course, to make sure you do not go too low down toward the roots of the front teeth to avoid uh, uh, giving those teeth a death sentence by, hitting the roots or, cutting through the skin down at the site where the gums meet the teeth.
Mhm.
So it can definitely be done skillfully versus unskillfully, and but either way, to your point, if you can design an appliance so that it's not necessary, then even better.
Exactly.